What's going on, everyone? Happy Friday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had taken a COVID test, hopefully you have tested negative. If you did test positive, I really hope you have a full and speedy recovery with no long COVID issues. It is time now for the Friday edition of the Pandemic Update for Friday, June 21st, 2024. If you're new to my channel, this is where we do the daily pandemic update on all things COVID and any other virus that could be a health threat to you. Let's face it, there's a lot of viruses out there. You need to be informed with what's going on with them, because if you're not careful, you could catch one of these viruses, and it could turn your life upside down. It really could. COVID can go on to cause long COVID. And it's also causing immune system problems as well. People who even just have a minor or mild case of COVID now have issues with their immune system not working the way it should. People's vitamin D levels are lower. People are constantly getting ill. It's not happening to everyone, but it is randomly happening to people, and it is an increasing number of people, but yet you hardly hear anything about it in the news. Want to stay informed about all this? Subscribe down below. Give this a thumbs up. Hit that notification bell. Share these videos with anyone you know, and leave your comments down below. I want to know, are you positive for COVID right now? If you are, let me know down below. Alrighty, today we're going to take a look at a few news stories. Then we're going to take a look at some new data, including brand new variant data. And unfortunately, some of our daily data just has not really updated. New York State didn't come in today. It says the new data on there, but when you look at the charts, you see the same numbers as yesterday. And on hospitalizations, same numbers that we've been seeing day after day. New Jersey, hardly any hospitals reported today. I know, not good for a Friday, but hey, there is some stuff to look at. New CDC data and some news. So let's get right into it. Willie Nelson, unfortunately, Willie Nelson is not feeling well. Now, we do know he is over 90 years old now, but we regret to inform you that Willie Nelson is not feeling well, and per doctor's orders has been advised to rest for the next 4 days. He is expected to make a quick recovery and join the Outlaw Music Festival tour next week. In the meantime, Lucas Nelson, a whole bunch of other people will be there. And unfortunately, Willie Nelson not feeling well right now. Moving on to this. Wastewater Scan did do their weekly update, and we're going to probably look at this, and then later on in the video we will take a look at Wastewater Scan's dashboard, because there is something erratical going on with their COVID data in the wastewater. But let's go over this. COVID-19 nationally, SARS-CoV-2 is in the high category with an upward trend over the last 3 weeks. The West is the only region that remains in the medium category. Does that make any sense? The West has been rising. We saw emergency department visits. You would think the West would be higher than the rest of the country. I don't understand it. Moving on to this now. Influenza, nationally and in every region, flu A and B continue to be in the low category and not in onset. And I should move back to this first one real quickly. Even though it says SARS-CoV-2 is nationally in the high region, please don't take that word high all that seriously. We are much lower. We are significantly lower than we were during a winter wave right now nationally. Although we are doing the slow and steady summer build. And you'll see that when we get into some more data as to what I mean about that. H5. H5 has been detected in 7 states: Texas, Michigan, Idaho, Iowa, Minnesota, South Dakota, and California. As of 6-24, Texas, Michigan, Idaho, Iowa, South Dakota, and Minnesota have all had infected cattle herds reported. HMPV is in the low category nationally, and in most regions. The Midwest is the only region in the high category. Norovirus is in the medium category nationally with medium concentrations, and now all regions are in the medium category. Nationwide levels are declining. All right, that's this week's wastewater scan update. Again, we are going to go to Wastewater Scan's website in a minute. There's several different perspectives now for wastewater. You got Wastewater Scan, you have the CDC page, and then you do have BioBot, which, by the way, BioBot updated yesterday, but I don't think we have that put up here for now. We don't have that up here for today's video. All right, I do have to tell you about this. Prevalence of long COVID rises to nearly 7% of the population, and it looks like this is from the United States. And it says statisticians from the United States Agency of Health, Care Research and Quality report in JAMA that as many as 17.8 million American adults have long COVID as of 2023. Let's read that again. 17.8 million American adults have had long COVID as of 2023. So that is a huge number. We're now in June of 2024. This number continues to rise. It's at some point, maybe even by the end of this year, going to hit 20 million. And it brings on to the point I like to stress many of times. It doesn't always matter how high current active infections are and current hospitalizations. When you have that many people with long COVID, plus people who had all the other stuff that would happen before COVID, it is putting a tremendous extra strain on hospitals, on doctors' offices, on specialists, you name it. Probably something we're going to do in the polls. I've been doing polls lately, and we're probably going to do another poll. I think it's time we do this. Have you had to encounter delays in trying to schedule an appointment with whether it be a doctor or a specialist? Have they told you, oh, I'm sorry, we're all booked up for the next several months, or we're booked up a year in advance? Yeah, I did hear someone say a year in advance. I forget where it was. Might have been up in New England somewhere. I am sure a lot of people have had this problem. We've talked about this before. I think I even did a poll on it before. It's time we revisit that, because when you have this many people going on to get long COVID, it's impacting healthcare. It's impacting the workforce. I see help wanted signs everywhere. Yes, I would see them before COVID, but it seems much worse now, and I'm hearing a lot of stories about people leaving their jobs because they are sick and cannot do their job anymore. All right, moving on now to this. Mike Horger did put his weekly update. He expects this is the PMC COVID-19 forecast, June 21st, 2024. Expects that 400,000 to 500,000 daily COVID infection a day in the U.S. for the following month. And you can see here, when you take a look at his graphic here, he expects it to drop a little bit. But then you can see post 4th of July, it does start to rise a bit. It's not showing a massive rise, but it does have a steady build. And probably the reason for this is you have to think that out in the West Coast, California, Hawaii, Alaska, you have to think that they're getting to the point where they're going to be seeing some sort of a peak where they drop. I don't know that whether they will peak, drop, and then rise again, but the fact that they're going to drop and there's not enough other places rising, it's actually going to cause the national level to go down a little bit. But then post 4th of July, there'll be enough places that are rising, or some that maybe just continue to rise slow and steady throughout the summer, where we'll actually see the national level go up a little bit again. And you can see that here in the composite forecast. It does show that directly after 4th of July, we start to see a little bit of a rise again. We'll have to see what comes of that in future updates. And you can see his full forecast over on his website. I did retweet, or repost as we say these days, his update. Alright, moving on to this. Speaking of polls, we just talked about me doing another poll at some point today. I will get to that. Do you think universal masking should be mandatory in healthcare? And an overwhelming number of people said yes. 995 votes. That's a lot more than the little poll we did yesterday. 94.9% say yes, 5.1% say no, and when you read the comments, I should say, you can see a lot of people said yes, and it just on and on it goes. It's pretty much absolutely yes. You get the idea here. There should be masking in healthcare. COVID's not the only virus that goes around in healthcare. All viruses do. We know masks work now, COVID being the most contagious. If a mask can work for COVID, imagine how well a mask can work at preventing a common cold or flu or some other respiratory virus where a mask just makes sense. Hospital-acquired infection. It's totally ridiculous. I mean, this is something that has been going on before COVID. People getting infected with something in the hospital. If we could have clean air and masking in hospitals, we might actually be able to prevent a few deaths, because sometimes when someone's already sick with something and then they catch something else in the hospital, you know what? That really increases their chances of having severe disease, and nobody wants that. Alrighty, moving on. Taking a look at today's pollen levels. 51% of the country is in the medium status, so in the low to medium status, and there is still red out in Oregon, and we do see some orange today in Colorado, in the plains, some orange and yellow in these areas. Northeast is not terrible. Southeast is doing fantastic. Taking a look at air qualities, 2 notes on that today. First off, the Northeast and East, anywhere east of the Mississippi, not good air qualities. Unless you're in the Southeast, that's not terrible. West Coast, it's wildfire season in California. They have already started up. New Mexico has started up, but we're not seeing terrible air qualities there yet. And I want to draw your attention to the Great Lakes. Yeah, really bad there. And New York State has actually put out an air quality alert advisory for the ozone today. This is coming from the Department of Health and the DEC, and you can see here it is unhealthy for sensitive groups. This includes New York City, Lower Hudson Valley, and Long Island, as is with all the traffic pollution around there. Yeah, this time of year just really gets bad there in New York. Heat-related illnesses, this map is going to continue to really go up because it is really hot here. I can tell you it is 95 degrees here in Northeast Philadelphia right now. We actually hit 96. The heat index that I'm showing is 100 degrees. Wow. So yes, it is really hot today. And let me refresh this because I want you to see this. We haven't showed this graphic in a while. It's the National Weather Service hazards map. You can see the heat. It's going to continue. Advisories and warnings are up for portions of the Ohio Valley and the Mid-Atlantic region. All right, you can follow more about weather over on my other place that I do that, which is on X, Climate Data Report. You can also look at today's weather video. We just did a short severe weather update for today, and we talked about tornadoes, and there's going to be the threat of wind and hail up in the plains. We'll have a more comprehensive weather update tomorrow. Probably talk about the wildfire situation and all of that. That's Climate Data Reports. And taking a look at Philadelphia today, 853 EMS incidents. Yes, that is a really high number. Unfortunately, with the heat, it's expected to be very hot through the weekend, so that number will likely continue. Taking a look at Montgomery County, Pennsylvania. And oh boy, I'm seeing a lot of calls right now. I'm seeing a lot of cardiac arrests. Not one, but two cardiac arrests in Norristown, Pennsylvania right now. Heat exhaustion, there you go. Heat-related illnesses, dehydration. Yeah, all these things are starting to pick up. Please, if you're in the area of the heat, make sure you're drinking your water. Like this. Very important that you keep yourself hydrated in the heat. Taking a look at what's going on in Chester County, Pennsylvania. Wow, yeah, very busy there as well. And you can see here respiratory difficulty, heart problems, exposure to heat and cold. Yeah, heat-related illnesses are starting up, and you can see here there weren't that many on the map for southeast Pennsylvania. Like I said, this map is really going to start to fill in as we head into next week. Walgreens this week, national positivity rate continues its steady build. It's now up to 30%, 27.1% last week, difference of up 2.9%. Total tests, 4,366 versus 4,213. All right, drum roll please. We have some new data here. This is coming from the CDC, and I want to draw your attention to the color codes on the right. So you see a lot of different colors here. We usually explain what this means on Wastewater Sunday. We'll give a little explanation now. Blue is very low levels of COVID, 0 to 19%. That number dropped by 20%. Not a good thing. It means that there's more sites starting to go into the higher categories. And that really is the case. These orange sites that are in the medium status, 60 to 79% COVID detected. It's now up to 108 sites, medium to near high. Very high, red sites, 80 to 100% COVID detected increases. There's now 53 sites in those categories. We see some in the southeast, see a couple in the northeast. We see a lot in the west. Hawaii still. I'm not seeing any in the Great Lakes, upper Midwest, but they're still low at this time. But we are starting to see a few oranges pop up, so I hate to say it, they may be coming for that area relatively soon. And take a look at this. Very high levels of COVID in a few places now. Missouri, Connecticut's very high, and I just found out. I should be thanking a person who left a comment. You know who you are. Someone left a comment the other day telling me Connecticut does not update anymore until respiratory virus season on their dashboard. So we won't show that again till the fall. But taking a look here, they're very high levels for COVID now. Florida's coming in very high. Missouri is very high. New Mexico, high in Utah, high in California, very high in Alaska, very high in Hawaii as well still. So you can see here, there are some places that are high, there are still places that are minimal. Pennsylvania, New Jersey, all still minimal. Look at this, New York, even though we see on their dashboard, they're seeing that small increase, that's a slow and steady build. Wastewater is still minimal, so hey, that is good news. All right, moving over to wastewater scan now, and I want you to see this. Remember we showed you at the near the start of this video, we showed you the rise in wastewater. There it is, right there. But now the update shows a real erratical shift right back down. Wastewater scan, I don't know what's going on. Someone did try to explain it to me. I still just don't get it. I guess it takes over time. When they update and correct it, their corrections are really erratical. I guess we have to go with what the older data says to smooth out older data. If that makes any bit of sense, I don't know. And you can see here the overall trend. It's upward in the United States, and then you get to about June 9th, and that's when this erratical business really started going. You can see in the past, you can clearly see where it had erratical movements in the past as well. This is for COVID on the national level in the United States. Taking a look now, drum roll please. I do need to refresh this piece of data, and we can see where there are increases in emergency department visits. Here we go. We want this on a percent change. And we can see here, look at this. There are definitely some increases in the Northeast now, increases in the Southeast, continue to be increases in the West, but you do have a few places here, like in Nebraska, Wyoming, Idaho, West Virginia, and Iowa, which are actually seeing moderate decreases in emergency department visits. We're not going to really go through any of these. Well, let's just go through two. We'll do Florida and Nashville. I got Florida here on screen. You can see Florida, that's starting to pick up the pace. You're having steady, moderate increases for emergency department visits for people diagnosed with COVID. And again, maybe they're showing up because of other reason, but they happen to be positive for COVID. That's what counts, because the more people that are showing up positive for COVID in a hospital, the more dangerous it becomes having to visit that particular hospital or that state's hospital. And you can see here, despite maybe a slight decrease in COVID wastewater in the United States, BioBot would suggest maybe there was a slight decrease this week. You can see here the national trends for emergency department visits. It's having a slow and steady build, and I think maybe next week we'll see a little drop before we continue to slow and steady build, but I'm just speculating there. It may be that it just continues a slow and steady build throughout the summer. Only time will tell. All right, drumroll please. We have more data. Well, speaking of building, we don't have any states now that are likely declining for epidemic status. We have stable or uncertain in many places, and quite frankly, I'm happy to see that Hawaii has finally stabilized. That's another reason for telling me that Hawaii is probably in the process of peaking right now. We'll look at more of those emergency department visits tomorrow, and you'll see Hawaii is probably on the path to peaking right now. It's growing or likely growing in much of the east. It's not doing anything in New York State because, well, it's not estimated. So we don't know what it's doing. It's doing something, obviously, but we just don't know what it is because it's not estimated. All right, moving on from this, we'll look more into this over the weekend. I have to show you today's variant update and refresh this, and you will see that KP.3 has grown. I thought I had this refreshed. I look at it elsewhere in another browser prior to doing these updates. As you can see here, KP.3 is now at 33.1%, KP.2 is at 20.8%, LB.1 is at 17.5%, KP1.1 is at 9%, JN.1.16.1 is at 4.4%, JN1.11.1 is at 3.2%, and KS.1, hello, welcome to the party, was that there last time? I don't remember, is at 1.8%, JN 1.7, 1.7%, you get the idea here. It's a lot of variance. JN.1, the original from wintertime, is now down to 1.6%. All right, let's take a look at this week's flu map. Do we really even need to look at this? You're going to see here that it is low or minimal pretty much everywhere. The majority, 99% of areas are minimal. It has now gone back to low status in DC, and here's what we can show you of New Jersey today. Not very high number of hospitals reported today, and 112. That's a relatively low number, but again, not many hospitals reported, so we don't know what the actual real number is there. And I am going to refresh New York State. Let's try this. We'll see. I hope we get something out of New York State today. And finally, we did. We can see here, it looks like, wow, finally, we got New York State. Looks like they updated what was missing from the last few days, maybe, or their numbers are just a little bit higher. You can see here, 1,404 new cases. Drum roll, please. I'm going to refresh the hospitalizations because I've been trying this all day and there was nothing. Okay, looks like we finally do have the hospitalizations for New York State as well. And there's now 673 people in the hospital, 42 in the ICU, and they are definitely on a steady rise now for hospitalizations here. You can see here, there's no doubt about it. Back on June 10th, 530. While the number is still relatively low, they're getting closer to that 700 mark, and they may pass that next week. The question will be, do they rise a little and then eventually drop a little, or do they just do a slow and steady rise throughout the summer? Guess time will only tell. As you can see here, the number of people testing positive does continue to rise at this time. Maybe some small signs that it's going to slow off, but I'm just trying to be optimistic wherever I can. But again, once again, New York State hospitalizations are slightly rising. Alrighty, folks, that does it for the Friday edition of the Pandemic Update. I will show you LA tomorrow, well, let's show you LA real quickly now. It's right here. I know, long video today. Cases, they continue to rise in LA. Test positivity rate, it's now almost up to 5%. And the number of people visiting the emergency department, that is on the rise, the percentage. Again, it's not how many people are there for COVID. It's the fact that, that's more disease and illness in the hospital. And if you're someone who's high risk and suddenly needs emergency care, that really gets risky for you to have to visit the hospital. That's the way I look at it. And again, like we stated at the beginning of this video, long COVID, it is a real big problem. And the number of people needing health care because of long COVID has gone up. Look for me to do that poll today over on my Twitter page, X page. And that does it for the Friday edition of the Pandemic Update for real this time. If you like this, give it a thumbs up, subscribe down below, hit that notification bell, and share these videos with anyone you know. I will see you all again next time. Until I see you again next time, stay safe, everyone. Have a fantastic Friday afternoon. Thanks for watching.